Welcome to the 30-Minute Growth Session, the show where transformation takes center stage. Hosted by me, Dr. Lisa L. Campbell, the Growth Motivator. Each week, we bring you dynamic guests who are all sharing actionable insights to empower your personal and professional journey. Are you ready to grow? Let's get started with today's episode. Hello, everyone. Happy New Year, and welcome back to another 30-minute growth session. Now, listen, folks. Today's guest is going to require you to commit to making some changes. I believe acknowledging that you need to change. So you definitely want to grab some pen, some paper, but also you want to enter today's 30-minute growth session with an open mind, because that's the first step for me in facilitating change. So my guest today is Hannah E. Mitchell, and I will tell you that Hannah is a nurse practitioner, not your nurse practitioner. So today's show is not designed to give you medical advice and solve all your problems, but I know the power of a coach. And so Hannah has some great things to share with you today. So let's dig in. Hey, Hannah, welcome to the show.
Thank you so much for having me, and thank you for that introduction. And yes, you're right. I'm a nurse practitioner. I'm a health and wellness coach, and I originally started out as a nurse practitioner, and I noticed there was this gap in healthcare where people were not seeking medical care until they had a health problem, and I was like, oh, wait, this is not the way it should be. And so that's when I started my health and wellness coaching business, where I really focus on preventive care. If we can work to improve our health with our current lifestyle, you will likely never have to see me in the hospital setting.
You know what? That's real heavy. Because let me just tell you, here in the Chicagoland area, as soon as the weather gets cold, our ERs are flooded with patients with respiratory conditions. Now, I will tell you, I used to be one of them until I changed my mindset about my health, my wellness, and do I get it right all the time? But let me just tell you, avoiding the ER is like gold, because that ER is so crazy. Like the TV show ER did not do a ER justice during the um the heat of, I call it the heat of the busy season, because you just don't want to go anywhere near an ER. And I know we have all of these different ways you can reach providers today, right? You got telemedicine and all of that, but I'm going to tell you about me. And maybe I'm a little biased because I've been in healthcare for 32 years. Having a primary care physician that, or nurse practitioner, physician assistant that knows you is so important when, not if, when something should happen and you need medical care. So it's like everybody has a BFF, you need a primary care provider. It's like, not, do I need one? I definitely need one.
Yes, absolutely. And, I feel the same way about health coaches too. It's a newer concept that people are starting to get on board with. But I honestly feel like if you have someone that can help you along to achieve your goals, we have business mentors, we have financial advisors, we need a coach to help us reach our health goals. And I truly, I've had health coaches myself. I've had different health goals that I wanted to accomplish, and it really makes a difference because they're there to support you, to guide you when you're ready to give up. We're that person that keeps you focused on your goal, helps you, remind you your why, and shows you, hey, yes, this is possible. You have the strength to do this. You can accomplish this. And so, I feel like a health coach is just that extra part of your healthcare team to helping you succeed and live the healthiest version that you can.
Oh, I love it. And I like the fact that you mentioned team, right? Because a health coach is not a substitute for having a primary care provider. You need a primary care provider, but you need someone that's going to hold you accountable and have some of those conversations with you about, like you said, you wanted to do XYZ. But I also think having a health coach allows you to have the conversations with your family members and your friends to be able to gather more data about your health history. Around the holidays,
Mhm.
a lot of times families get together and we spend all that time eating. Well, not in our household, because literally, I'll just tell you, for like Christmas, we had 4 items and that was it. And
Oh,
part of
wow.
that, maybe because we're empty nesters, we're like, we don't want to have all that food in the house. And then, like, a day and a half later, the food was in the garbage because we were just like, all right, we're done with this. But when you're gathering together, whether it's family or friends, I think it's important to have the conversation about what's in your bloodlines, right? Like, you have a family history. Like, I have a huge family history of atrial fibrillation. Every woman on my mother's side has had atrial fibrillation. So that's important for me to know, right? But I think we don't want to have those conversations because they're not fun. But I don't know. It's like a life or death situation. I think it's important to have the conversation so that you can prevent things from happening.
Exactly. I think awareness is key is once you kind of know, oh, I have a family history of heart disease, of atrial fibrillation, whatever it may be. Once you know those things, you're like, okay, well, I can't control the genetic component. It is what it is. But what can I do on my end to make sure that I'm doing everything I can to reduce that risk of that happening to me? Or if it does happen, what am I going to do about it? And how do I be aware to know when my heart rhythm starts acting up? I should know, okay, I need to seek medical attention at that point.
It's so funny. So about 5 years ago, my mother called me on the phone and was like, "My watch said I'm in atrial fibrillation." And I'm like, "Why are you calling me? Why don't you call 911?" Right. So, but my point is, right, the watches aren't perfect, but the watch did alert her to the fact that there was something going on. She called 911. She definitely was an AFib. And just a funny thing, because I just have to share this. My mother probably will kill me, but so I get to her house. She was 12 minutes away, and the ambulance was there. And they were like, "Okay, ma'am, we think you should go to the emergency room." And she was like, "Yeah, I'm going, but my daughter's taking me." I'm like, "Mom, I am not, I am the administrative side of healthcare. Why do I have to be the one to deliver you to the hospital?" But we did, and all was well. But um, I think it's so important now more than ever that we become serious about our health, because I learned last year, and not learned like something I didn't already know. So I'll say I experienced a fracture that had me down basically from September to December. And let me just tell you, atrophy from not using my leg set in. And I was like, okay, body, I realize that you do listen to us not taking care of ourselves. And it wasn't I didn't take care of myself, I just fell. But the fact that I couldn't use that body part and how it just got really weak, and the journey to getting back to walking, it gives you a whole new perspective on how your life could change suddenly, and what could you have done to prevent it? Now, of course, falling, what could I have done to prevent that? I don't know. I thought about that for about 30 days, crying about falling. But there are things you can do to prevent, right? Everybody knows about mammograms, right? Every October, everybody's all busy with the mammograms. I personally get my mammogram in November, so everybody else can have those October slots. But there are so many different things we should be doing to prevent. And I think we just don't really take them serious.
Exactly. I think that a lot of times when people are like in their 30s and 40s, they take their health for granted sometimes. And then, as they continue to age, different health problems start kind of creeping up. And, it's really important at that younger age to really start focusing on your health and paying attention, because prevention is the best way to manage a risk for heart disease. And so, if you have that family history, like you said, it's important to start very early, doing different things, whether it's screening tests that you can do for heart disease, high blood pressure, cholesterol, doing those routine things to make sure, because a lot of risk factors for heart disease do not show up with obvious symptoms. And so, people can go years with having high blood pressure before they ever find out that they do. And so, it's very important that you are, getting those routine health checkups with your primary care doctor to screen for these. I know so many people in their 20s, 30s, and 40s who don't go to the doctor because they're like, I feel fine. And that's really not the reason to not go to a doctor. You should still go for all of those screening tests to kind of screen for any underlying risk factors for bigger concerns like heart disease.
Wow, you know what? I just had this flashback. So first of all, at my young, tender age of 51, I definitely figured out that you don't bounce back like you used to. But I'm reminded of when I first entered healthcare, 1992. I was in school for medical assisting. And when we learned about hypertension, they said it was the silent killer, right? And so we learned about it. But it wasn't until I remember working with a cardiologist. We had a young patient that literally probably was about 5 years older than me, and he came in with different complaints. Blood pressure was through the roof, like in the hypertensive urgency crisis state. And I'll never forget, the doctor had all of these additional tests planned for him. He never got to do them because he died.
Yeah.
And as a young person, that hit me like a ton of bricks. I'm like, this guy was literally not that older than me.
Yep. Yep.
So silent killer is true.
Yeah, yeah. And, people may experience some vague symptoms and they may, complain of, oh, I'm just overworked, I'm tired, or, and you can blame these vague symptoms on so many different things. And so it's very hard to navigate sometimes the symptoms you're feeling, whenever something's going on in your body. And so, the screening tools that we've talked about are important. And then also making sure that you're living a healthy lifestyle. And, that can be adjusted based on where you're currently at with your lifestyle. I know that there's a lot of things out on the internet, and you can make your healthy routine as elaborate as you want, but what I think is important is that you make it realistic for you. And so, wherever you're currently at in your health journey, let's just try to grow and improve from that stage of your life. And over time, you're going to see a huge transformation in your lifestyle.
I love it. And I will tell you, I will be the first to be very transparent about my own health journey. I remember 10 years ago, I made the decision to have weight loss surgery. Now, do I regret it? That's another topic for another show. But one of the things that I'm reminded of about that journey was you had to make certain changes in order to qualify for the surgery. Okay, so now fast forward to today. There are all of these things on the market to help us lose weight, but then those things have lots of side effects. And as I think about my own life, I think that there are a lot of things that I would have done differently had I had a coach. And I always had a primary care physician. I'm in healthcare. I believe in having a primary care provider, but having a coach would have been something that I believe would have made me make different decisions. that would have been sustainable for a longer period of time. And so let's talk about this concept of heart health coaching. Tell us all about what you do.
So, the origination of this concept of the business that I've created is I have been a cardiology nurse practitioner for many years. And so, this is my world. This is what I know. And, I really wanted to bring coaching into a perspective of we know that heart disease is the number one killer in the United States. And we also know that nearly 80% of heart disease is actually preventable. And so bringing that concept of, okay, if it's preventable, how do we prevent it? Because it's not that people don't want to prevent heart disease. It's not that they don't want to die from heart disease. They want to live a healthy life. It's they don't know the steps to take to make it actually happen. And so, there's a lot of health coaches out there. And, while we all have similar things that we do and focus on improving lifestyle, I really like to bring it into a perspective of we know you have these risk factors, we know you have these heart disease problems, and how can we adjust your lifestyle so that we can reduce that risk? You can potentially get off blood pressure medicine or cholesterol medicine. These are things that has to be done with a team approach. This is not something you should just stop all of your medicines and say, I'm not going to take medicine. That's not what I'm saying at all because I prescribe medicine all day long. But you have to talk to your primary care doctor. And when it's time, there is a path for you to be able to come off medication, reduce your need for heart surgeries and different things of that nature. And so, really taking that approach to living a healthier lifestyle, because there's ways that we can prevent heart disease, and I want to help you do that.
I love it. And you when you mentioned the word surgery, I just got a little triggered because my little ankle surgery was a whole vibe, right? So I could just imagine, what if I didn't have a stable, health status, and I went in for surgery, anesthesia, all of that, and had all these other problems. But having surgery is life changing. And if
It's a
you
big
can't,
deal.
yeah, I mean, it's not just a big deal for you as the patient. I was fortunate enough for my husband to be able to wait on me hand and foot, and he's the best candy striper in the whole world. Oh, I forgot. He actually through the weeks he actually got promoted to a CNA, but but him having to work his job, but then tend to my every need was life changing. Right? It was a I was in a very vulnerable state. He had to give me sponge baths, and I literally lost my independence for a little while. But I think one of the things that saved me was mindset. Right? I was like, okay, first few weeks, I just really did not want to eat, right? And then once I kind of got my appetite back, I was like, all right, you need to order meal prep because you need to have healthy meals because you can't cook. He can't juggle all this, right? So I had to have healthy meals showing up at my door every Monday morning. It allowed him to have food, it allowed me to have food, and it really helped with the healing process. But what if I didn't have that mindset and I just literally sat in that room and was pressing Uber Eats and DoorDash, every day for food? That's not sustainable. And one of the things I said once I became non-weight bearing, I was like, I cannot gain any weight. I was in a journey of losing, and I was like, I can't come on the other side of this with more weight on my body. And so I'm so thankful that my mindset was right to help me get through the journey. But I think a lot of times people are afraid to know their numbers. They're afraid to know if they have high cholesterol or diabetes or whatever the case may be. At 52, I have a blood pressure cuff next to the side of my bed. I measure my blood pressure every week. Just and not that I'm being like over the top, but it's like I want to live. And in
Yep.
order to live, I got to know my data.
Yeah, I think for a lot of people, out of sight, out of mind, it's easier. It's easier until it's not, and I think, that's one of the things that people have to mindset. They have to work on their mindset and get over, like, I do need to know these things and I need to know so I can change what I'm doing. And I absolutely do a lot of mindset work with my clients because that is the core. If you can get mindset right, the rest is gonna fall into place.
Absolutely. So I was noticing on your website, you were talking about, things that you can do to help with having a healthy heart. And one of the things that I think people often take for granted is getting a full night of rest. And I'm not talking, and notice I said rest and not go to sleep, because many people lay down at night, but they're not really resting. And then they wake up and they caffeinate themselves and do it all over again until something happens.
Yep, your body has to recover, and the way that it recovers is with sleep. And so, really preparing, a lot of people have trouble falling asleep. They have a hard time turning their mind off. And so, creating some sort of atmosphere or like sleep routine that kind of prepares you for sleep, you're setting yourself up for success. And so, creating those routines and, today we're on so many screens 24/7, and so training yourself to get rid of screens 30 minutes to an hour before you go to bed, find another activity to do during that period. Different things like that can help. Yes, there's sleep medication out there, but I kind of like to have that as like a last resort. I feel like the less amount of medication the better. And so I do work with clients on trying to figure out how can we induce better sleep for you. And so doing small simple things can actually help. And I think sometimes a lot of people think if it's simple, if it's small, then it must not work. A lot of people think health being and living a healthy lifestyle has to be this huge impossible task, and it's not. It's a bunch of small simple things stacked on top of each other that over time creates that healthy environment for your body.
Oh, I love that. So it's those little tiny habits. Those little
Absolutely.
small things, right, that you have to do. And if you are, I can just speak for my own household because it's my husband and I, it really has to be a coordinated approach. So, for example, I recently made him an appointment at the dietitian because I said, I'm telling you what she's telling me during my visit, and you're thinking I'm nuts, right? And I have this binder with all of these things. But once he went and heard it from him for himself, now we're coordinating with some of the meals we have. So like I know tonight we had a dish that was a little different, and once dinner was over, he said, "So, what should I do with this dish? Should I put it in the garbage or put it in the refrigerator?" I'm like, hello, I'm going to have that for lunch tomorrow. But I think it's the mindset of it's not something that we're used to eating.
Right.
But because I have my book and all the things that I know we're supposed to be having, and I told him, we're not getting any younger. We're grandparents, we're climbing towards 60. And my grandfather celebrated his 104th birthday, December 22nd, 2024. And I'm like, I want to live long like granddad, right? But you
Yeah.
can't live long if you don't treat your body right. And
Yeah.
and the body
Absolutely.
is not forgiving.
Yep. Yeah. And, there's this concept that I'm sure you've heard that's been floating around forever, but it's like an 80-20 rule where 80% of the time you're killing it, you're doing a great job, but you allow yourself that wiggle room because we're not perfect all the time. And so if hey, I've got some flexibility, I'm going to eat certain way the majority of time, but when we have a family get together or, we have a sporting event or something like that, I know that I'm going to eat, pizza or something that may not be as nutrient dense, healthy food that you normally consume. And that's okay. I think moderation is very important on someone's health journey.
Absolutely. And it's so funny as you learn more about the things that are not necessarily good for you. I have found that I don't know if my mind and body were having a conversation with each other, but like my husband will buy certain things and then I'll taste it and I'll be like, "Oh, I don't want this." And then I look at the item, "Oh, it's on the list of things that I'm not supposed to have." And it's not that I'm depriving myself. I legit just don't like it anymore. Like for
Yeah.
example, Chinese food. I'm like, I just cannot bring myself to eat it anymore. And
Yeah.
so, hey, however I can get it, I'll take it. Because I'm literally in this book with all these recipes, really making the change. And again, the fracture was life changing. I don't think I will ever be the same.
Well, and I think you're better for it. It was a very tough challenge for you to go through, but you've come away with a lot of positive things that you can apply to your life, down the road, lifelong.
Absolutely. So we're almost out of time, and we have to know, where can our listening, viewing audience find you? Because everybody likes to Google. So what's the first place you would recommend they go to find you, learn more about your services, perhaps consider if the two of you want to work together? Because one of the things I'll tell everybody as a growth coach, I'm not for everyone. Everyone's not for me, right? But I can tell you, Hannah, just from having this, and we don't know each other, right? We just got on for this 30-minute session. I can tell you that I have enjoyed just our dialogue. You seem very easy to talk to. Now, I do know there's this other Hannah that will say, "Now, girlfriend, we talked about this 30 days ago, and what happened?"
Yeah, 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 and then that's my job, I gotta hold you accountable. But no, so Instagram is probably the best, easiest place to find me. My Instagram handle is Heart Health Coaches, and so you can find me there. And also, I just started TikTok, and I am horrible at making videos, so I'm on there, but you may not want to follow me. You may not be entertained. I'm just saying. But no, Instagram, I'm always on daily, and so you can find me there. And then I also offer a free newsletter that you can sign up for, and you can find that a link in bio on my Instagram page. But that is where I can, provide a lot more education, in-depth education on heart health and lifestyle tips.
I love it. Well, I want to thank you for the work that you're doing, because we definitely need it. And I think when people hear the term coach, they don't really understand the impact. But when you think about, so I'm a Chicago Bears fan, right? And on Thanksgiving, our coach was fired because he wasn't really doing a good job, right? But coaches are really designed to help you reach that goal by supporting you, by being your cheerleader, having those tough conversations with you, but really it's all done in the goal of helping you achieve what you say you want to achieve, right? So like
Yep, yep.
my Chicago Bears, they want to achieve the Super Bowl, and we're not there yet, but we'll get there one day before I die.
Yep. Absolutely. Yeah. And, when I have my first interaction with someone, we chat about what your goals are because not everyone has the same goal. People have different health goals that they want to accomplish. And so we sit down and we personalize a plan, and I'm there to be your biggest supporter with also years of experience in doing this.
I love it. And a plan, right? Because in sports, they have a game plan. And
Yes,
sometimes the game plan has to be altered to eventually score a touchdown. I watch
that's
way too
right.
much football.
Yes, but absolutely, your health is just as important as sports.
It is. It is. So, Hannah, what's the one word or words of wisdom that you would like to leave our listening, viewing audience with today?
I think the biggest thing that people need to take away is that prioritizing progress over perfection. If you can make those small changes, um, growth isn't about perfection always, but it is about making better choices today than yesterday.
Oh, that is a perfect way to end. So, listen, everyone, this has been another 30-minute growth session with me, your host, Dr. Lisa L. Campbell, the growth motivator. We'll see you next time. Thank you for joining today's episode of the 30-minute growth session. Growth happens when we take action. So take the insights from today's show and turn them into impact. You're just one step away from the next level. If you enjoyed this episode, don't forget to like, share, and subscribe. Let's grow together. See you next week.